Now we continue with the pathogenesis of neonatal sepsis, which is going to correspond to the cause. Now, we need to know that what the pathogenesis of neonatal sepsis depend on the classification, which is early and late onset neonatal sepsis. It is very important to have this pathogenesis in mind. Now, the point that you should have in mind is that in early onset neonatal sepsis, generally the infection is coming from the mother. When you have a patient that has early onset neonatal sepsis, that infection or the microorganism that the child is having is as a result of the mother. So early onset is less than 3 days. If you have infection of a child where it is less than 3 days, it means that it is the mother that is the issue, that is the problem. Is it clear? So you have to test. In the test you're going to visualize how to prevent the further reoccurrence, and I'm going to explain you what are the investigation that you do on the mother in order to prevent the further recurrence of a early onset neonatal sepsis in the further children of the mother. Now, when you have late onset neonatal sepsis, now it is the infection generally from the environment. Is it clear? Generally, the infections of late onset neonatal sepsis from the environment. So those are the two major pathogenesis under which you have early and late onset neonatal sepsis. Pathogenesis of early onset neonatal sepsis from the mother, infection from the mother, while pathogenesis of late onset neonatal sepsis, infection from the environment. Now, let's visualize. While knowing this, you now have to ask yourself, what are the microorganisms that can pass from the genital tract, the microorganism that can pass from the genital tract of the mother and either ascend to the fetus, or when the fetus is going to descend through the birth canal, is going to infect the child. Is it clear? So from the mother can transmit the microorganism to the child. There are different methods via which the mother can transmit microorganism to the child. The first method is through a maternal-fetal circulation. Maternal-fetal circulation. Is it clear? When you have a maternal-fetal circulation, you can have transmission of microorganisms via the bloodstream into the umbilical cord. And generally, for the maternal-fetal transmission, it is very rare causes of neonatal sepsis, like the torches infection. Generally, when you have the torches infections, which is made up of the toxoplasmosis, which is made up of other microorganisms, the rubella, cytomegalovirus, we have herpes, we have Epstein-Barr virus, and we have syphilis. Is it clear? So generally, these microorganisms, which are associated with touch infections, are not typically associated with neonatal sepsis, but are instead associated more with congenital abnormalities, particularly if the torches infection occur during the first trimester or during the first half of the pregnancy. Basically, so when you have the maternal-fetal transmission of the torches infections, is going to mostly result to congenital abnormalities than neonatal sepsis. Is it clear? So you can have true maternal-fetal circulation transmission to the fetus, and it's going to be via the torches infections. And I've said, don't go and say that the torches infection are generally the causes of early onset neonatal sepsis. Torches infection are much more associated with congenital abnormalities when it's going to be occurring in the first half of the pregnancy, because by that time you still have embryogenesis and the formation of the different organs. Now, the second mechanism via which the mother can transmit the infection to the child is via the ascending route. So via the ascending route, you have different risk factors. The risk factor under the maternal-fetal circulation or transmission is that the mother can have a cases you can have a mother having a systemic infection, like before the mother gives birth, she was having fever or any sepsis. Is it clear? If the mother has fever before she gives birth, it is probable that the infection, the bacteremia that was inside the bloodstream of the mother, has transmitted also to the bloodstream of the child, resulting to the early onset neonatal sepsis. So in cases where you have a mother that was initially having fever from any etiology, is it clear, and then the child has fever, you can also guess that there is a maternal-fetal transmission, and you treat the microorganism that the mother was found to have. Is it clear? So those are the different things that you have to evaluate. Now, the two major mechanisms via which you have maternal-fetal transmission. This is via the first mechanism was through maternal-fetal circulation. The two major mechanisms are via one, ascending route, and two, we have the passage of the fetus through the birth canal. Is it clear? So those those are the two major mechanisms. Now, in ascending route, we can have different risk factors which can be associated with the ascension. Normally, we need to know that what this is the uterus like this is the cervix here. Is it clear? Normally, when the membranes are closed, the infections we need to know that you have generally the normal flora of microorganisms inside the vagina of the woman. Normal flora of microorganisms inside the vagina of the woman. And peculiarly, if a woman has a group B streptococcus, the group B streptococcus is usually associated with early onset neonatal sepsis. Now, provided that there is a premature rupture of membrane, these microorganisms that were inside the normal flora are going to ascend and they are going to result to the infection of the fetus. Is it clear? It's going to result now to infection of the fetus that is inside here via the ascending route if there are risk factors like the premature rupture of membranes. Is it clear? Other risk factors associated in this case with ascending route, we have instrumental or we have artificial rupture of membrane. If you have an artificial rupture of membrane with an instrument that is not sterile, you can have ascending route transmission to the fetus. Is it clear? So those are the different things. Anything that is associated with the rupture of membrane, like premature rupture of membrane, or you have also prolonged rupture of membrane, provided that the rupture of membrane